Hi everyone. Have you ever thought or taken action of what would happen during an allergic reaction? I have been allergic to peanuts since I was 3 because I tried a peanut butter and jelly and I felt like my lungs were like not working and I felt a little swelling in my throat and it felt irritating. But luckily, I had not used my EpiPen yet if I ever get a severe allergic reaction. Today, I want to inform and to explain to you guys, my audience, of what an EpiPen is, the effects from an EpiPen, and how an EpiPen works. First off, what is an EpiPen? An EpiPen is a medication prescribed first aid or life-saving injector for allergic reactions. According to Cheryl A. Thompson in the article, Know What's in Airplane's Emergency Kit, 2 pharmacists say, EpiPen can also help treat cardiac arrest. The main purpose of an EpiPen is helping a way to breathe better. Next, the effects from an EpiPen. According to WebMD and their page, EpiPen injection, the side effects after using an EpiPen is fast heartbeat, nervousness, sweating, nausea, shakiness, dizziness, and so many more. Make sure to get or call emergency medical help right away, especially if the side effects gets worse. Once again, a doctor should prescribe it to anyone who has a certain allergy that relates of lack of oxygen. Finally, how an EpiPen works. This here is my personal real EpiPen. However, I'll be using my practice training one. If you can see the difference, of course. And it has a seal as well. My real one does. This one is just practice. The first step is to twist the cap off and to show the orange cap or the orange point where the needle is at. The second step is to pull off the blue safety release cap. The third step is to firmly push the orange tip where the needle is at onto your outer thigh until you hear a click. And hold it in for 3 seconds. Remember, you should be trained or know how to use an EpiPen properly so you won't harm anyone who has an allergic reaction. According to Sam Murr, Marnie Robinson, and Mimi Tang, from the article, Doctor, How Do I Use My EpiPen? There are some people that are not able to demonstrate it correctly, nor how to use it correctly, from maybe a lack of training or just from panicking. We don't know. There's many reasons. But there's such as not holding it in place for less than 5 seconds. Make sure to have 2 EpiPens. One for at home and the other one by your side, no matter where you're going. It could be at work, school, at a friend's house, or at another family member's house. Epinephrine autoinjector, or EpiPen, can help so many ways and affect so much. To sum up what I said today, I have explained and informed you guys of what an EpiPen is, the effects, and how it works. EpiPen is one of the safest treatments for you to be able to breathe and help stop the swelling in your throat from an allergic reaction. But always be careful and take precaution no matter what from an allergic reaction in helping others. Safety comes first.